Hello and welcome to Full Circle. My name is Lisa Schilling and I'm the Executive Director of the South Central Louisiana Human Services Authority. And we're really excited to have our program today. We're going to be talking about advocacy. And we're going to be talking about advocacy on behalf of behavioral health, which is something that's not widely done here in our community or in the state of Louisiana, for that fact. And so that's why this program was titled 911 Behavioral Health Advocacy Efforts. So we want to make sure that everybody gets some education on advocacy today and that we're talking about what's going on in our communities. And so with that being said, the format's a little bit different for Full Circle this time. We have some guest speakers that are going to be talking to you about what they're seeing in their own prospective areas for behavioral health and how they're dealing with that in their jobs and in the community. And then more importantly, we have a live audience today, and they'll be involved in asking questions of our panelists at the end of their presentations. And so I would also like now to introduce our co-sponsor for the event, which would be Mental Health of America, the Baton Rouge affiliate. And here to speak to us today a little bit about them is Ms. Laura Lanier. She's the Manager of Advocacy and Target Health. Laura?
Hi, welcome to you all today, and thank you for being here. This is such a great opportunity, Lisa. Thank you to all of your team and to the station, of course. Just wanted to introduce that we are the Mental Health Association of Baton Rouge. We are an affiliate of the Mental Health Association of America. And that means that since 1954, we have been an organization that has been very involved in working with mental health abuse or disorder and substance abuse disorder. We work with that in several programs, one of which is the one that I'm over, which is advocacy, doing what we're doing here today. Education, trying to change some stigmas, and really doing outreach and letting people know resources for these issues. The other programs that we administer and are a part of is a drop-in center, which is a day program for people that do have mental health and dual diagnosis or disorders. And they also have a program where we have residences that are programs for people that are dealing with substance abuse disorder. They're in recovery, so we work with them oftentimes with what's called co-occurring disorder, which in this day and age is behavioral health, which brings us back to what we're doing today. We're looking at advocacy, how to make this a better state for people that have these issues, and how to be better resources for people that want to help their loved ones. We want you to know we're here as a partner, and we have a card in the information with our numbers and contact information. So please know that if we can do anything to advance help and recovery issues, we are here as a team member. Thanks so much.
Thank you, Laura. Can we give her a round of applause? And I don't want anyone at home or here in the audience to think that we have forgotten where we're at. We're at HTV. So Mr. Martin Foltz is here, and he's in the audience. He'll be doing the facilitation of our question and answer session toward the end. So thank you, Martin, for hosting as well. So I want to set the scene a little bit and talk about advocacy, if we can, for just a minute. And you see on your screen that we do have a definition there. Advocacy is an activity by an individual or group that aims to influence decisions within political, economic, and social systems and institutions. Advocacy includes activities and publications to influence public policy, laws, and budgets by using facts, the relationships, the media, and messaging to educate government officials and the public. And advocacy can be through a host of different means: media campaign, public speaking, commissioning, and publishing research. But I don't think that we can talk about advocacy unless we talk a little bit about the stigma that are related with behavioral health. And so I just have a few things up there I wanted you all to think about while our panelists are speaking today, and for those of you at home as well. It says we all experience emotional ups and downs from time to time caused by events in our lives. Behavioral health conditions go beyond those emotional reactions and become something longer lasting. They are medical conditions that cause changes in how we think and feel in our mood. They are not the result of personal weakness, lack of character, or poor upbringing. With proper treatment, people can realize their full potential, cope with the stresses of life, work productively, and meaningfully contribute to the world. Without mental health, we cannot be fully healthy. But yet, understanding behavioral health isn't only about being able to identify symptoms and having a name for these conditions. There's a complicated system involving local communities, the federal government, research institutions, private companies, and other pieces that are all trying to fit together. Each piece contributes to our understanding of mental health. If one is missing, the picture isn't complete. Before we proceed, I want to talk a little bit about our event guidelines. So each panelist will have 6 minutes to speak. At the end of their presentations, we will open up the floor for questions. We ask that you fill out the speaker card that was placed in your seat if you wish to pose a question to one of the panelists, and then raise your hand, and Mr. Foltz will assist you at the podium to address the panel. So let's get started. Let's look at these distinguished panelists that we have here today. So we have Mr. Brian Zarang. He is the Thibodeau Chief of Police. Ms. Karen Stubbs, the Deputy Assistant Secretary, Louisiana Department of Health, Office of Behavioral Health. Sitting beside her is the Honorable Jerome Zarang, Representative District 52. Most of us know him as Z. We have Ms. Christine Russell, Lafourche Parish District Attorney. Dr. Victor Tedesco, Terrebonne Parish Coroner, and Ms. Lauren Johnson, St. Charles Care Center. And so, Brian, if we can, we'll start with you and talk to us a little bit about what you're seeing as a first responder in the community.
In the community, what we've seen is across the board. You've seen everything from PTSD, substance abuse, depression, anxiety, and you're seeing more and more, I think, and a lot of it has to do with social media, because with social media really putting it out there, more people are getting involved, more people are picking up on what's really going on in their communities. So with that being said, I mean, it was important that we put training together, which we started, the Crisis Intervention Training, which we call CIT. And the CIT training is both for patrolmen and dispatchers. For the patrolman and the officer working the road, it's a 40-hour course. We got a class that just started this past Monday, right, and it's going on this week. And dispatchers do an 8-hour. And it's important. If we've noticed a difference, because anytime we deal with the public, a lot of times, sometimes it's on good terms, but most of the time it's a tragic or some type of crisis. And what we want to do is de-escalate the situation. And when you're dealing with people that has some behavior issues, you want to de-escalate because they're not thinking correctly, and you want to communicate with them. And I find the training help, and if you remember, you and I spoke, we were only doing it once a year.
Right.
Now we were able to do, we had bumped it up to 2 a year, and now thanks to Lafourche Parish Sheriff's Office, they were able to obtain a grant, right, and now we're able to do multiple classes per month. So that's helping to try to get, law enforcement and first responders through along with the dispatchers. So with that being said, I think it's imperative and it's important. And we've noticed, just dealing with the community, we had a situation where some of the guys that had been through the training was involved with a suicide. Well, we had a guy downtown in the early hours with a gun that wanted to commit suicide. They were able to talk him down. We were able to get him the help he needed with no incident whatsoever. So that was great. It was all part of the training, be able to talk, de-escalate the situation, not escalate the situation. I had another situation where I was called with a lady who the family was having issues with because she didn't want to the neighbors were complaining, she didn't want to get rid of anything. She wanted to keep everything she had. And the yard was starting to cause problems for the neighbors. So with that being said, I went and spoke with her, and now we have her working with us. Instead of going write a citation or putting her in jail, which is not the place for people that's having these mental issues. Right. Spoke with her, and we're making some progress along with her and the family to get her to start cleaning up and taking care. So it's just how you talk to people and de-escalate it. But like I said, we've seen it across the board where it's starting to pick up more and more. And we're trying to avoid the suicides if we can. We're trying to avoid putting people in jail because that's not the place for them. They really need help. And I think the more we can educate the public and first responders, the better off we are, because we can catch it in the early stage before they start committing crimes. Because we've seen people with behavior issues where if it's not detected or it goes undetected where nobody's monitoring that person, you wind up seeing that they're committing these crimes and they wind up in jail, and that's not the place for, they need help, not to be locked away and put in jail.
I'm glad you make that point, because it really is not a place for those individuals to be in the jail setting, because
No.
there's so much more that they need that we can do through treatment. And I also just want to shout out to you, because when you all had the lady in your last example with the hoarding, you contacted us. We have a
Correct.
peer involved with her now and staff, and I think that's made a huge difference for her as well. Can you talk really quickly, too, about what you're seeing in the community with opioids and using Narcan and the training there?
Yeah, and we've used Narcan already. I know some of the other agencies in the area has also used Narcan to bring and save people's lives, but it is a problem. And I mean, it's how you combat that problem. And I mean, it takes a community effort. The police can't do it by themselves. I mean, we can only do so much, but it's a team effort. And programs like you have here and getting the audience that we have here, I think we can combat it and work on, clamping down on the problem that we have. But we've seen a large problems with it, yeah.
It's about education.
Absolutely.
And I think
the
that's what
more
we're
we can educate, the better off we are, because early detection is the key. But the only way you can have early detection, people have to be involved, they have to understand and be educated on what to look for, what's the signs, so that we get the right resources. And that's the kicker, is having the resources available that we can direct these people to the proper resource they need.
Thank you so much, Brian. Appreciate it.
Absolutely.
Yes. Next, we have Ms. Karen Stubbs with the Office of Behavioral Health. Karen, do you want to tell us what's going on statewide?
Great, thank you for having me. Hi, I'm Karen Stubbs. One of the biggest trends we see nationally is the utilization of peers in the treatment process. Well, at the beginning to engage in treatment, during the treatment process, and throughout that journey of recovery. There are over 30 states in the country that have peers as a Medicaid reimbursable benefit, and Louisiana is not one. One of the things we at the office have been working on is incorporation of peer as a Medicaid reimbursable service. I think, it is an evidence-based model that shows a higher increase in getting people into treatment, both on the mental health side and the substance use disorder side. They stay in treatment and they're more engaged in treatment longer, and then they maintain recovery longer when they have a peer working alongside them. And a peer is someone with lived experience, so someone themselves who's had a mental health or substance use disorder and is in recovery. Having someone to talk to that has walked that walk and done the journey themselves just makes you feel not so alone. Sometimes it's a trust issue. Especially at the beginning of treatment or being convinced to go into treatment, you don't trust that doctor or that counselor, but you do trust the person who's next door who did the same thing and kind of came out the other end in a successful way. So on the state level, that's something we're very focused on. I know here locally, you also have made that a priority. So this region's very lucky that you are progressive thinking, but on a statewide level, we really kind of need to get with it. So we'll be working on incorporating that and the budget that comes alongside it. Another area that I'm seeing, and you touched on it, is around suicide. Suicide is the second leading cause of death between ages 10 and 34. And so it's everywhere. It touches all of us. And I think one of the things we need to be aware of is making room for that conversation and asking the question. I followed a case last week of a 16-year-old adolescent girl who was regularly seeing a counselor. The counselor had regular communication with the school and the family. The counselor called the school and said, I think you need to do some extra check-ins. And the school administration between classes caught her just to say, hey, how are you doing? And as the principal started walking away, she said, I have one more thing to say. And she confessed that she had gone to great lengths and thought about suicide in the past week. in the middle of the hallway while she was changing classes, which I think is the perfect example of the fact that it's not sitting on a doctor's couch when it's going to happen, that you need to make room for that conversation. And it's very difficult to ask that question and to create that space, which leads me to kind of my next point, which is, of people that commit suicide, only 46% of them have a diagnosed mental illness, which means over half of them aren't involved with a counselor, which means the community and the family and the neighbors and the schools need to have some awareness of signs and symptoms, which is why I'm such a big advocate of the mental health first aid and the suicide assist prevention trainings, which are geared towards lay people and teach them how to recognize and open up that conversation, because you never know when someone's going to be ready to talk about it.
Exactly.
So.
Yeah, and we have taken on that challenge in our own agency and are doing youth mental health first aid trainings too. And I just spoke with you beforehand and talking about doing that throughout the state with school resource officers, because there's a real need for them to understand what they're dealing with in that setting.
There is, and to practice being comfortable asking. I'm not aware of many places doing the youth mental health first aid. When you told me that, it's amazing that you have those resources and that priority here, and it's so useful, just like the situation I described that happened last week.
Yes.
So.
Thank you very much, Karen.
Mm-hmm.
Representative Zarang, what can you share with us? Because the budget is huge and the session's about to start.
Yeah, it all comes down to funding, like
That's
a lot
it.
of things. But first off, I want to thank you for hosting this and for everyone in attendance to highlight this issue and create more awareness, because the reality is, from the state's perspective, obviously, I'll be the first to admit, sitting on appropriations last term, is that behavioral health services are woefully underfunded, and we need to increase the funding as best we can. But the reality is, there are so many requests and so many asks. Fortunately, this upcoming term that we're about ready to start, we're not in the position we were last term. Last term, we were addressing over a $2.6 billion deficit. So at this point, we're at least in a positive mode in terms of the funding that we have. The Revenue Estimating Conference hasn't met yet, and that is essentially the estimate in terms of what the state will have for the next fiscal year for budgeting. And it's at that point where the governor makes his budget, and then it goes through appropriations and everyone else, and that's when we start funding the agencies. But given the fact that even though we're not in the deficit, I know in talking to Lisa and others, that there are agencies who are undergoing budget reduction measures and already preparing for less funding than they previously had, which is not indicative, or is not, in terms of addressing these issues, not going to provide the additional or more money that we obviously need. So we need to work toward that. The other unfortunate reality is, and I know Chief Zarang and Christine can attest to the fact that because of the lack of funding or lack of awareness, and what we see mostly in testimony from a lot of the committee hearings is that jails and prisons are the de facto mental health institutions, and it unfortunately gets to the point where they're incarcerated that can get some attention or try to at least create the awareness that there is a need. And by the time it got to that point, that is obviously not the place where you need to be treating these issues. We're going to work toward, I know there's an incentive to try to get early childhood education, and with that, hopefully if we can, provide some funding to address this issue in behavioral health sciences and studies toward addressing children as early as we can to help in address these issues and needs.
I appreciate that, Z, and I also want to give you a shout out because when we go to session, I have to go and sit through House Appropriations, Senate Finance, and then the Dual Budget Committee, and he's always so responsive. He is our legislative liaison for our agency, but I'm busy texting him during committee, and he always answers, and so that means a lot too, because he really understands what we're focusing on. So I appreciate that. So Christine, can you talk to us a little bit about what you're seeing also in the judicial system as well?
Yes. So in 2003, when I went into the district attorney's office, I saw that the court system and the district attorney's office is so limited in what resources we can provide to people in regards to mental health. So about a year and a half ago in our office, we hired an LCSW, Ms. Heidi Irwin. We brought her in for many different reasons. The first reason was to expand our victims department. Number one, our job is to protect the public, but we also want to hold the hands of our victims, and we never want to forget our victims. So we expanded that department, and part of her job is to make sure that when our victims come in, we address any mental health issues that they may have. You can take the simplest of crimes, it may be a simple battery, or you can take the most severe, a family member was murdered, and we have to make sure at the end of the day that we provide the care and the mental health guidance to these individuals, and that is what she's there for. We also wanted to use her when it comes to our defendants and our perpetrators. So we have a PTI program, which most DA's offices have. It's short for Pretrial Intervention. The purpose of it is when you have a first-time offender, you can have them go through a program in your office and provide services to them in hopes that they will not reoffend. Through the office, we can provide services that oftentimes courts cannot. So what we've done in our juvenile system as well as our adult, if you have a first-time offender, one of the conditions that you'll have to do is get assessed by our LCSW. And before we had the LCSW, you look at the crime and then you provide conditions for them to fulfill, standard conditions. But we know that each person's different. The crime may be the same, but two people may have an underlying issue that's completely different. For example, we may have a DWI, and two people went out and and the facts read identical. They got pulled over, they blew into the intoxilizer, everything's the same. And before, we would give them standard conditions, a fine, unsupervised probation, alcohol information school, and we would hope they would never reoffend. Now, with an assessment, we can find out why they have that DWI. Sometimes Heidi will evaluate them and say it was just a mistake. And so those conditions, our standard conditions, are just sufficient. But sometimes we'll find out that they're struggling with depression. So why do I want to make the conditions the same? I don't. I want to make sure that we address the depression issue so that they won't reoffend. And what we've seen since she's joined our team is that our recidivism rate for PTI is less than 5%. That is incredible. So we're addressing mental health not only with our victims, but certainly with our perpetrators, and especially our juveniles. They will have mental health assessment as well to see what's going on with our juveniles. And finally, we're trying to be extremely proactive. A couple years ago, I went to all of our schools and I asked the principals what was their main problem that they're seeing with their children. And with our middle school kids, suicide assessment had gone up tremendously. So we have two programs in our office. They're called PEP, Personal Empowerment Programs. So for our girls, we're going out and teach them about self-esteem issues and hope that we can build up their confidence. And with our boys, it's conflict resolution. So our goal is to be proactive, and because I firmly believe if we want to attack the problem, it has to start with our children. And if we tackle the problem with our children in 5, 10, and 15 years, we're going to see an entirely different community.
I appreciate that. First of all, thank you for being so forward-thinking to bring a counselor onto your team and staff. I think that makes a huge difference, gives you a different perspective. The other thing is that you're exactly right. Prevention is the key. We provide that at our agency as well, and we truly believe, like you say, that if we're talking to those children and we start like second, third grade on up and talk to them and give them tools that they have in their toolbox, they're going to make wiser decisions later on in life. So thank you for that. Dr. Tedesco, I want to hear what you have to share with us. I know we talk about it a lot of times in our board meetings about what happens when people get really ill and they wind up in the emergency room and it's a long hospital visit or stay, and then sometimes they just can't get out of that rotation. Those doors keep revolving. So what can you share with us?
Well, I'll just say that the coroner's office involvement is always a very difficult time for the family and very stressful. We don't actually treat anybody. What we do is we facilitate and we certify. When somebody is admitted to a hospital against their will, that takes two physicians. It takes a treating physician, and then it has to be certified by a coroner. What usually happens is that the family will go to the coroner's office and discuss the reason why they think this individual needs to be admitted to the hospital, because they refuse to go in on their own, and they believe that they're a danger to themselves or others, or gravely disabled. And that's called a protective custody order that we issue. We issue somewhat over 100 protective custody orders a year. But once this individual, once the protective custody order is issued, it's transmitted to the local police agency, either the sheriff's department or the Houma Police Department, and then that individual can be picked up and placed into protective custody and delivered to a treatment facility where they can be evaluated by a physician, oftentimes a psychiatrist, but not always, to determine whether or not they're a candidate to be held in a psychiatric treatment facility against their will. They also have to have a medical clearance, which will include a drug screen. If they are admitted to the psychiatric facility, then the coroner has to go in and do an examination within 72 hours of that admission to determine that he agrees that the admission criteria were met. And so that person, for mental health problems, can be held for 15 days against his will. For substance abuse, it can be repeated a second time, so you have a total of 30 days. So those are the two ways that we interact in this. We don't treat anybody. But when we look at our data, we do almost 1,200 psychiatric evaluations a year, and when our staff looked at it, it was on 900 and something individuals. But unfortunately, the way that mental health system is working throughout the state, there's not always a bed in the parish. So if you go to the hospital and you need to be admitted to a psychiatric hospital, they have to, the emergency room has to find a bed for you somewhere. You can wind up anywhere in the state, and usually you're not in your parish, and it may not be the same hospital you went to on your previous admission. So, but we still can track the data from our parish, because the coroner's office from the parish where you went to will send the certificate to the coroner's office where you came from, because we have to pay for his services and vice versa. So we do most of our certificates, coroner's emergency certificates. About 2/3 are for our own residents, and about 1/3 are for residents from other parishes. As far as pediatrics, we don't ever see the pediatric cases in our office because they're being sent to other parishes. But we look at the certificates that are sent to us. There's about 120 something from our parish a year. And they're going to Caddo Parish, Morehouse Parish, and Calcasieu Parish. So that's basically the way we deal with it in the coroner's office. When we look at the data, what we find, though, is a significant number of these cases. We have a case number for each individual, and we can look at the number of times that the same individual comes through our office in a given year. And I have 123 repeat offenders in 1 year. And these individuals may be candidates for a program known as Assistive Outpatient Therapy, where it's a program where if you have repeated admissions for failure to comply with treatment, a judge can order you to be placed in involuntary outpatient treatment, and your physician has to make a plan for you. You have to have a assertive community therapy team to follow you. It's complicated. It's not done very often, but it's something we can look to in the future, because I think the coroners are the only ones that have enough data to be able to identify the individuals who might benefit from this.
That's excellent. I'm glad you pointed the information out about the inpatient beds. Here in our 7-parish catchment area, they're woefully inadequate. We have approximately 100 adult beds scattered through the 7 parishes, a few Jerry Psych, but there are no child and adolescent beds. Right. And so it's very difficult for families sometimes when you have to separate them. Their children are going off, like you said, maybe North Louisiana or other places. Parents can't get there with transportation. So it's a difficult time for the entire family. So that's something that we need to consider too when we're looking at resources for our community. Thank you. Lauren, we're so glad that you're joining us today, and I know you're going to touch on a little bit about what Christine and I talked about, which is what we're seeing in the school settings and with our children in the communities.
Yeah, so in St. Charles Parish, we have various different initiatives going on within our parish to try to better serve children and families. it's a vague statement because we're trying to kind of look along the spectrum where children and families are being serviced and where they're being seen by different systems. So the St. Charles Care Center is a part of a coalition in our parish that is made up of the court system, the school system, the DA's office, law enforcement, community-based organizations, faith-based organizations. We have this huge coalition of organizations that are really trying to improve and help families make better progress in accessing these services. And so when we first got this started in 2017, we really focused on the court system. We wanted to make improvements with our diversion programs. We wanted to ensure that all juveniles who are currently court involved were able to access services similar to what Christine mentioned. So ensuring that there's a screening process in place and that families are getting access to needed treatment services based on the results of a screening. And so in the past about 6 months, we're really excited about some new initiatives we have coming up with our school system. So we didn't want to just stop at ensuring that kids and families who are coming in contact with the court system were getting services, because it's too late. So what could we do to try to move upstream, if you will, to try to kind of see those early indicators of either mental health disorders, risk of suicide, behavioral health, and this is like within families as well as with kids themselves. So our school system is in the very, very early stages of a pilot of what they're calling the social and emotional wellness program. So we're doing two things, and I say we because, like I said, this is all part of a coalition. I work for an independent nonprofit, but we work really closely with the school system. So we're doing two things. One is a universal screening process that we hope to eventually every single school in our public school district, every student in certain grades will be screened, universally screened for risk of mental health related disorders. So sometimes we have kids who suffer in silence and they're not the ones who are getting in trouble and they're not going to come into contact with the juvenile justice system. So what can we do to notice those kids and get them services as quickly as possible? And then the other thing that the school system is doing is they're actually hiring full-time mental health professionals. So that's a pilot program. They've just hired 3 new mental health professionals that are going to be placed in schools. They're going to be able to, kind of coordinate some of the screening work, but also just play a major role in they are going to be the ones that it's their jobs to try to work with those kids who are, they're seeing the early warning signs of that and ensuring that they get connected to services. So we're really trying to, fill the gaps within our systems along the spectrum of need for families to ensure that, children and their parents, it's not just about the kids, but ensuring that the environment and the folks in these children's lives are also getting the services that are needed to help them succeed in life. So we have a lot going on in St. Charles Parish right now.
Yeah, those are all great initiatives, and I know that we have staff that participate with the coalition, and we're really excited because it's taken us about 10 years, but our agency is working now with St. Charles Parish School System to provide prevention services. So we're in a pilot for 2 of their grades starting this semester, and we're going to be doing life skills training. So we're really, really excited about that, and that we're hoping that will make a difference with everything that you all are doing as well.
Absolutely.
So we've come to the end of our panelist presentations, and so we're about to open it up for question and answer, and so they're all getting geared up, you can see here on the panel, to answer your questions. I just want to remind you that you need to fill out a speaker card if you have one. You want to answer a question, ask a question. Those are in your seats, and then we're going to turn this session over right now to Mr. Martin Foltz, who's going to be handling the audience participation. Martin.
All right, thank you, Lisa. Any volunteers who would like to be the first one to ask a question? All right, come on up. Would you like to do it at your seat, or you want to do it? All right.
My name is Sparky Trahan, and I'm a peer support specialist for terrible and behavioral health. My question is to anyone on the panel, would little satellite places like help with the overcrowding, where the police would have some place to bring someone to assess them for their mental health instead of going straight to the hospitals, tying up the emergency rooms, and help people get mental health services faster. I moved here from Michigan, and I went through a system like that. I went to what is called PIC, Psychiatric Intensive Care, before I went to a hospital. Before I went to a facility, they diagnosed me and did me there and sent me to where I had to go from there. So it's all questions open to anyone.
Sparky, you're talking my language. It's mental health, emergency room extensions. We want some of those bad in our area. We'd like one on the Bayou side with our Bayou parishes and one also on the river side. But I'm going to turn that question over to Karen Stubbs, because I think we've had that conversation before.
I was expecting that, Lisa. So I think yes. Just to have a really direct answer, different levels of services within the crisis continuum would alleviate so many pain points in the behavioral health system for both mental health and substance use. We agree, and on a statewide level, we are in the process of developing a comprehensive crisis system of care statewide. So that would include things like mobile crisis units, crisis, behavioral health, urgent care walk-ins, 23-hour bed placement facilities, again, the entire continuum. The problem is when you're in crisis, you can't really stop and say, I'm sorry, do you have insurance? We don't accept that. And so that is what we were trying to thoughtfully think through, is that how do you develop a true comprehensive crisis system of care with those different levels of crisis intervention and do it regardless of payer source. So the state is researching that. We've identified a model state that we really like their system. It's regardless of payer source. It has lots of different crisis levels. And we're working with some consultants on how to develop that. Clearly, people are in crisis every single day. So the fact that I'm saying we're working on it isn't helping the person today or tomorrow. But because it needs to be done so carefully and how it's funded is so complicated, we need to be able to use state general funds and Medicaid and bring in those commercial insurance that most states have not had success in. And we're starting to see some pockets in Louisiana where commercial insurance is starting to play ball. We're starting to see Massachusetts that's making a little headway doing that in a state-run crisis. So stay tuned, not this session, but maybe next session. Hopefully we'll have that formalized enough to have a real vision to start to implement.
Representative Zerain, we're giving you like vibes. If there's funding that can be put toward that.
I didn't place myself next to him, but you did, and I think that was smart.
I did. So. All right, Martin.
All right, we're going to step up a little bit. Let's get him in a good camera shot right here for our next question.
So obviously there's a lot of stigma associated with behavioral health and mental health issues. What role do you think media plays in that, and how can media help reduce some of that stigma?
Does anyone take a stab at that one? Go ahead, Karen.
I can.
Yes.
So, and I know you mentioned
Yes.
the media and social media, and especially with adolescents, and so I echo what he said, but I also think, our terminology is really important, and a lot of people who aren't in our world and talking about this all the time don't realize that when you use terms like, oh, she's psycho, she's crazy, that really, it implies a violence, it implies an embarrassing illness, and that those types of terms you need to have an awareness. When you use things like, I've got to go clean my room because I'm just so OCD about it. And we say it in jest with no harm, but borrowing that illness for someone who doesn't have the illness is really, when you don't truly have that, increasing that stigma and the negative thoughts associated with it. So I think awareness about how we use terminology is so important. And clearly the media, that's not their priority, it's not their focus. Arguably, they would probably argue it's not their responsibility, but starting to have that conversation, which is why I'll go back and plug the mental health first aid, which talks a lot about terminology and signs and symptoms of real mental illness, is so important for the lay person, the general member of the community to have had.
You're exactly right. And, you know, I also want to go back to what Brian shared with us about the crisis intervention training that we do with our law enforcement professionals. This hits home for our agency. We recently had a staff member whose son, who's autistic, was in a situation, and the media sensationalized it and just took it out of proportion. And, you know, that family is still dealing with that and suffering through that. And so I almost feel like sometimes we should have them in a class so they can realize that, you know, the things that you say, the way you present them, the way they're handled do make a difference. Martin.
All right, we have another. Don't forget to say your name when you come up too. We want to, you know, I want to give you a little TV time here.
My name is Renee Ring. This question is for anybody on the panel. Can you share what you're seeing in your professional line of work that's influenced by behavioral health, either directly or indirectly?
Brian? Christine? Lauren?
I guess the training we talked about is really effective since we had it, because when I first started law enforcement over 30-something years ago, I'm not going to say exactly when I started, because it put me way back, put me old.
Child prodigy.
But we didn't have any type training like that. And when you dealt with it, you were dealing with all crises the same way. And a lot of times, you know, the police went there, we didn't have time to spend a lot of time, and you did what you had to do and get out, chances are you were going back. But I find with the training, you're able to talk to people, de-escalate, and chances are you can come up with a good solution and have the resources now we need. And that helps, because I sit on the board, and that's important to know where your resources are, because the average officer before didn't have any idea who do we reach out to. And I had an incident with one of my guys where I didn't know who to reach out to, because, you know, we had him evaluated, we sent him off, and where they put him at was not the best place in New Orleans for him to be in his line of work, okay? And I was able to contact Lisa, and we were able to get him out of that place and put him where he needed to be and get the help that he needed to get. So it's important, you know, to have the resources and have the training. And I find it's helped a lot since we moved in that direction, a positive direction.
I'm probably going to step on someone's toes if they have this question in the audience, but we as an agency, our staff, and other social service providers in the community are so thankful that we have drug courts in our parishes, but what we don't have is a mental health court. And so while we're here, I'm making a big plug for that. We'd love to see district attorneys step up and say, we want to be a part of that. We want to see that happening in our communities. We want to provide a setting for our behavioral health individuals to go and to have individuals working with them that understand them and the things that are going on in their life and help give them coping skills. Dr. Tedesco, I know you and I talked a little bit about that as well. Do you want to share any of your thoughts on that?
Well, like I said, if you look at the data that comes through my office, a lot of people that are being admitted to the psychiatric hospital are repeat offenders. It's almost a revolving door. And the AOT laws, the Assistive Outpatient Therapy laws, offer a mechanism to, oftentimes an individual may not respect a family member, or they might not respect their doctor, they don't want to take the order, but they might respect the judge, the black robe. And so if an individual has had to be readmitted to the hospital twice within 36 months, he may be a candidate for an AOT order. It's a little bit complicated, and it requires a lawyer for the family that's asking for it, a lawyer for the individual, and a treating physician who's willing to testify, and a treatment team. But if it's done, in areas where it has been done, it drastically reduces the number of readmissions for noncompliance with treatment and gives you a better chance to have a good result. And as a matter of fact, there's a judge, Curran Reese in New Orleans, who has an AOT court, and he's invited me to come next month to his monthly meeting he has, and I'm going to see how they're doing it over there. And hopefully, with some help from Lisa, we might be able to get something going in Terrebonne Parish and in the surrounding parishes. But it's not simple, it's going to be complicated. But the data shows that I can almost identify 120-something individuals in Terrebonne Parish that may benefit from it. But you have to be careful about how it's done, because the coroner is not a treating individual. I can only refer them to the court and let the court decide whether they're a candidate.
Christine, I don't know if you feel like there's a need also there in Lafourche Parish for that type of court.
I don't have the
Kind of
date.
putting you
I'm
on
sorry.
Yeah.
I can't answer to the date. I'll let Christine Russell.
I think the concept is fabulous, and I certainly think we would need it. I think it all goes down to funding and resources. It always does. It always does. And I
You're in the
think
middle for a reason, Z.
the staffing that would be required, and we have probation officers, of course, that we put people in supervised probation and they staff them. We would truly need case managers to ensure these individuals are taking their medication so that they're in compliance. And so I think funding's the issue about paying these case managers, paying for a staff like we do for drug court. And so I think while it's wonderful, it will all go back to funding.
It is, and there are grants out there that are available. I think that it's just like trying to figure out where we want to start, who wants to start first, and then trying to plug that in. So thank you all. Martin?
State Representative Zarang, now you know why they put you right in the middle, right? All right, come on up. All right. Your name first?
Amber. And my question was actually similar to that and on the same lines. And those of you in the legal system, thank you very much for taking that step forward. And I wanted to know if you're seeing a trend, since you're doing it in your own areas, but are you seeing a trend of it spreading, hopefully to other legal entities, of the move to get people referred in the pretrial, hopefully before, kind of like you talked about, getting them referred in a pretrial? Are we moving more towards that now before further probation? Do you see that growing in other entities, or is that just something in your area?
I certainly think across the state this conversation is being had. When I talk to other district attorneys, we certainly are all engaged in the conversation about mental health issues and how do we address it in our areas. So I certainly see it expanding. Within our own agencies, whether it be the Sheriff's Office, obviously Thibodeau Police Department, we certainly are all addressing it as well. The Sheriff's Office in the new facility they have, there are programs there for the inmates. And so I know, of course, Lafourche is certainly addressing it in all of our agencies. But I think you're going to start seeing across the state different parishes, different jurisdictions, putting together programs to address mental health. It is a topic that everyone is discussing about how do we incarcerate these individuals that truly do not need to be there, but they need treatment. I think the more we have discussions like this in tri-parishes and other areas, the more that we're going to see improvement, and the more that we're going to see people talking about it and trying to come together to find some ideas.
Thank you, Christine. And also want to put a plug out for that new Lafourche Parish Sheriff's Office complex. It's beautiful. It's such a step up for them. Not that you want to go visit it if you've been called in, but just to go there for a meeting. Yeah. For a meeting, it's very nice. Yes. Martin?
All right, Mike. Mike's been looking forward to this for quite some time now. Yeah, go up there. You want the podium? You got it.
Good morning, everyone.
Good morning.
My name is Michael Jones. I'm from Houma, Louisiana. I have a question for the panel I'd like to ask. Is behavioral health an important issue in our communities, and if so, why?
I think we can all take a stab at that if you want to. Brian, you want to start?
Yeah, we've seen an influx in it, and I'm going to tell you, I was getting ready to mention, what we also see is homeless coming in from outside the area with mental health issues. Mm-hmm. So we're not only dealing with the local people in the community, but we're also seeing people from out of town, out of state, that are wandering into our parishes and in our cities with mental health issues. So like Doc and most of the panel was saying, the resources are important places where we're going to place them, and again, you don't have the bed space like we talked about, but we're starting to see an influx in it. So yes, it's very important. I think these panels that we have and the gathering we have today is very important, but we can't let it stop here.
Right.
We got to continue pushing, and we got to continue having these meetings. We got to continue putting groups and committees together to make sure it gets to Baton Rouge and we get the help that we need. Because if we just talk about it today, we go about our merry little ways, nothing's going to get done. Correct. So we got to continue pushing to make sure that we get these problems solved.
Thank you, sir. I have a question for you.
Okay.
It's a two-parted question. I wish that Homer Chief of Police was here, but
Dana's a great guy.
great guy. Yeah, he grew up in my neighborhood. He's from Mechanicsville. Crime is high in the Rouge and the Terrebonne area.
Absolutely.
And a lot of people suffer with mental health issues and not aware of it. There's a side of mental health issue where people are addicted to drugs, and there's also a side of mental health issue where people have a behavior problem. And we got a lot of lost people out here with behavior problems.
I agree.
And just don't know. But sometimes when the police are called, especially if you have a background, you handle according to your background, and sometimes a person just vent out. Like, I've been in a situation, and I'm speaking for self because I come from that background where I suffer with the behavior problem. And a person just need to vent. Because if you can release what's inside of you without acting on it and just venting, then you're no longer harboring that. You're giving yourself time to reset and, you know, get that second train of thought where you can think about it. Most of the time, people just go on their way, but to some people, it causes fear. And when you put fear in a person, they're gonna call the police.
Correct.
And I'm trying to see, can we get some kind of advocacy going in or some kind of outreach program for people with the behavior side of problems so they can be aware of different laws, because I think if you educate yourself on laws and the consequences of your action if you do a certain thing, then a lot of things won't happen. And I say that to say this here. I like to take the time, first of all, to thank the mental health, because within these last 4 years, I've been a productive citizen in society. I was on the other side of the rope where I was constantly making mistakes since 1998. I never remained in society for 2 years straight. I was in and out, revolving doors. But today, I'm educated. I have a degree in electrical. I'm in my third semester of HVAC. And after finishing school, after a couple of years employment, I plan on being a business owner. So I want to take all that mental health has helped me in gaining my life and be an advocate and be some support to bring those type of people to make the best out of them. I just don't know where to start.
Right. No, and I agree with you. And I think a lot of times what I tell my officers, think about the people we deal with majority of the time. When they see the police, it's not on good terms.
Right.
It's always will be on negative terms because there's some type of crisis that's going on. We also talk about it starts at home. And in today's society, there is no home life. So we have to understand that. So that with the training that we're doing, the CIT training, that covers all of that aspect. It brings it all in proportion. So everybody understands why they deal, when we're dealing with people, why they act the way they do.
Right.
And it's like I tell them, sometimes just let them vent. They need to vent. You're right, you know, and we have to handle it that way. But I find the training is helping because, again, they're living on the street, a lot of them.
Right.
And when they come into contact with us, it's not in a good mode. Most of the time, there's something going on. So I'm trying to make the officers understand, too, let's get out in the community and do more in the community and interact in the community, in which we've started that. Christine can attest to that. We started some programs working together to get out into the community with the police and break that barrier. And the Law Enforcement Commission that President Trump put together, that the U.S. Attorney is going to head up, that's part of the program, finding out why we have this disconnect with the police, why law enforcement has disconnect. So that's part of it. It's also going to cover mental health. It's also going to cover suicides, and it's also going to cover opioids. So there's going to be a real thing.
Combination.
Correct. There's going to be a real thing, and that's something that we need to do. But yeah, if you want to get together, you and I and Chief Coleman.
Right.
And I know he wanted to be here today, but they had another meeting right now dealing with some of the problems that we talked about that's going on between the parishes. So they had another meeting right now.
I live in Rouge, but I'm from Terrebonne.
Right.
So
But I'd be more than happy to sit down and try to see what we can do, because we are meeting in the communities and trying to interact with the communities and build that rapport, which we're doing a great job of from where it was. But you're right, a lot of times they don't understand. We have to educate. It goes back to education. We have to educate the public to understand why we do what we do and what the laws are. I did that at Nichols State University. We went meet with all the fraternities and sororities to make them understand Why are we downtown in Thibodeau doing what we're doing for underage drinking? What's the reason we're there for? And once you break that barrier and make them understand, then they're comfortable with the police. And like we tell them, we have a job to do, and we're there for a reason. Once you explain to people why you're doing what you do, it's normally not a problem. It's when you go there and they ask the questions, and it's the old mentality.
Right.
Yeah, I know exactly where you're coming from. Yeah.
Thank you so much.
No problem.
And I have a question for you that's at the coroner's office. I know besides what you explained that you do, y'all see a lot of death totals from homicides and everything like that. You know, there's a lot of foolishness that's going on in the area between Lafourche and Hummer. And I keep speaking of Lafourche and Hummer because that's the two parishes that I'm back and forth within. And I just would like to, you know, like get some input on you so I can bring awareness to people to like try to get them out of that behavior pattern that they're in and let them know that the work that y'all do, that all y'all have to go back and reconstructing the body when somebody done messed it up, someone's life, done took someone's life behind pettiness or foolishness or things like that. I'm all for the peace of better humanity, and I just want some insight on what I can do to help advocate.
Well, that's a good question, but I don't know if I have an answer. But when we see somebody that's been involved in a homicide, and a lot of them are drug-related homicides, it's usually like an execution. And they've been shot multiple times, and then we're dealing with a lot of overdoses. I think 2017, we had 53 overdoses. If we go back historically, it used to be around 10 or 11, and it was usually polypharmacy, you know, people just taking too much of prescribed medication and add a little alcohol to it, and occasionally see a cocaine, occasionally a heroin. Now we're seeing a lot of heroin, a lot of fentanyl, and the users are not used to the fentanyl, and it's so potent, it's so powerful, they don't have a chance. They're dying from a drug overdose and respiratory depression. Ambulance services are carrying the Narcan on, and I was told last week that last year I think they had about 200 incidences where Acadian Ambulance had to administer Narcan, and probably saved some lives in cases we didn't get to see, fortunately, in the coroner's office. So I think the whole community needs to be aware of how dangerous it is, what the dangers are involved in doing the drugs, and they may be getting something. They are getting stuff now that they don't know what they're getting, and it may be lethal. And usually it is by the time we see them, you know.
So Mike, I can answer that question for you. What you can do is exactly what you're doing. Mike is a patient at our Terrebonne Behavioral Health Center, but he's also the chairman for our Regional Advisory Committee, and he's doing an amazing job. He is advocating. He is helping to get education out in the community. He's sharing with us things that we need to do better in our clinic setting so that we're making sure that we're meeting the needs of the clients that come in. And so you are well on your way to being the advocate that we need in this community. Can we give him a round of applause?
Thank you, man. No further questions.
Thank you,
Let
Mike.
me ask the panel a question too. How has heroin and opioids been a game changer? Dr. Tedesco, when we started this station, it was marijuana. It was marijuana back then. Nobody overdosed on marijuana that I know of. Then it was crack cocaine. Then it was all kind of other stuff in between. But the game changer now is opioids. How has that changed what you do?
Well, like I just finished saying, we went from about 10 cases a year to up to 53, and now this last year it was down to 37. It's not only 30, but down to 37. And it's just a tragic part of what we have to do.
But why did it go down? I know Narcan, but are people starting to listen now maybe a little bit?
It might be that, but I think a lot of it has to do with the Narcan. I think that people are being rescued before it's a fatal thing.
And Chief, what are your numbers, real quick, in Lafourche, and maybe Christine too?
It varies. I don't have the top of my head, but it varies. But we still seen a lot of everything start to pop back up. At one time, like you said, crack, marijuana was the big thing. We start to see that pop. We still see heroin. We hadn't seen any fentanyl in a while. But again, there's some stuff that's coming across now too that Narcan won't work on.
And Martin,
So they always change it, just like we had with some of the synthetic marijuana and stuff. You know, you pass laws and then they change the formulas. So then you got to go back and change the law again to add those changes. So they're constantly trying to stay ahead of the game. But I think, Doc, you're right. A lot of it too is fear. I think the media helped put that fear in, tell them how scary it is, because you really don't know, if this stuff is laced with this stuff. So they kind of start to back off of some of the stuff and going back to some of the old stuff.
I guess my point is you cannot make a mistake with fentanyl.
no.
I mean, me and the doc were talking, he's been on my show a couple of times. You make a mistake there, you're not waking
how
up.
dangerous it is that we actually keep Narcan at the Terrebonne Parish Morgue and on all of our coroners units, because we may come in contact with it when we're dealing with the victims. They may have it in their pockets or whatever, or if one of my investigators goes to a scene, he may come in contact with a powdered form. So we've never had to use it, but it's a possibility. It could happen. So we're aware of it and we're prepared to deal with it.
And Christine, as a prosecutor, you've been around for a while, y'all used to try cases that didn't deal with this kind of stuff. So y'all have had to switch the way y'all prosecute, don't you? Or maybe throw a little compassion in there also, trying to figure out what's going on.
We talk about the epidemic. The epidemic has just changed. I mean, when I first got in the office in '03, it was crack cocaine, and we saw a lot of those cases. And now we're seeing across our parish a lot of heroin cases. The trick with the heroin cases is, how do you treat it? So how do you provide services to someone who has an addiction to a drug that we don't know how to treat, other than saying go inpatient? So the difficult thing for us is we're at a point now, if someone comes in, even a first-time offender, and their charge is heroin, I don't know if we have any services to provide other than saying go inpatient, or you have to go to court and have on your record that felony. So it's really difficult when they're so far gone with their addiction that it is something like heroin or, God forbid, fentanyl. So for us, definitely the compassion's there, but whether or not we can truly provide services to help them is our problem.
In Lauren and St. Charles, I know parish to parish it differs. We saw 53 deaths in Terrebonne. I think Chief Zarang, y'all had 19, might have been the highest.
I think the highest we have is 19.
And that's neighboring parishes. What about St. Charles Parish?
I mean, what we've done is we've altered how we're, what we do at the care centers, we are screening kids and families. And so, we do a substance abuse screening, but I make sure to specifically ask about experimentation with different drugs. They'll maybe just say, oh, I smoke, but I'm like, let's actually get into what else what else you tried, because we want to really try to get a handle on the experimentation that's happening early with young people. And some of it is prescription drugs that they're experimenting with, and they don't, they may not have the education they need to understand how serious it is.
Martin, can I add to that too?
Absolutely.
Yeah, so we have funding through the Office of Behavioral Health to provide Narcan and to provide training in the communities, and our crisis team has probably handed out over 1,200 of those kits, and we go out everywhere. We go to first responders, we're fire, we're at pharmacies, we talk to everyone, the emergency rooms and dealing with those. But Karen, can you share a little bit about the statewide form that we have right now?
I sure will. And so I'll talk just a second about Narcan or naloxone, the fast-acting opioid overdose reversal. It's most commonly come in the nasal spray format, but there's a standing prescription, so anyone in the community can go to their pharmacy and get Narcan or naloxone, one's the brand name. And so we encourage people, if you think your neighbor, if your son or your son's friends, or maybe you're live around a school, anywhere you think you may, and these days you don't know where that might happen, come across, walk across, be be in the vicinity of a potential opioid overdose, have it, the general resident citizen can go get that. It's also covered by Medicaid. I actually just spoke to the judges conference last week in New Orleans and encouraged those judges as they see people coming through their court, whether it's criminal court or drug court or family court or divorce court or DWI court, to incorporate that into their conversation with the defendants, or even plaintiffs or victims, that this is out there and it does save lives. And if you don't have if you aren't overdosing from an opioid, it doesn't hurt. So there are good Samaritan laws and no liability concerns there. And so we're doing our best now to get the word out about that to non-substance use kind of professionals and people in that world, because they need to have access to that as well. We're working with the Board of Regents to implement a policy for the 4- and 2-year colleges to have it on campus with their responders and in their residence halls, and they've been very supportive. LSU had several deaths related, LSU's main campus, to opioid overdose, and so that needs to be readily available. So those non-traditional avenues is where we need to focus. Martin?
All right, we have another question from the audience. Your name first.
My name is Casey. I can't see his name. But as far
Chief Zerain?
Chief Zerain. Yeah, for Mr. Chief Zerain.
My name being screwed
My question is regarding, as far as the jail and prison system for inmates who have documented mental health histories but are now incarcerated. What exactly is being done as far as having them receive services within that system?
I would say the new complex we have in Lafourche, Sheriff Weber is on top of that and very advanced in making sure that they're getting the help that they need, because that's what that whole jail was built on, trying to get them back into the community so that they can function in the community. So there's a lot of programs in there, and that's also part of dealing with the mental health that's incarcerated. The thing that, like was talked about, you want to try to not have them incarcerated in jail and try to give them the help they need, but unfortunately we limit on space where we can put them to get the proper help that they do need. Because a lot of times, and we dealt with that already, they get out, they're living on their own sometimes, nobody's checking on them, they feel good, so they get off the meds. Next thing you know, we dealing with them again. So it's a revolving door. So that's why I think the education comes in. If people can kind of watch and help with that, but they are working. I know, and I can speak on behalf of Lafourche, and Christine could attest to that too. I mean, Lafourche is working to make sure that they're getting the help they need while they are incarcerated.
I will say this, the sheriff hired a forensic psychologist when the facility opened, who's on staff, who's actually doing assessments on those that are in the facility.
I have another question. We work for the Single Point Assessment and Resource Center of Terrebonne Parish. So basically we're a preventative measure. We see kids with mental, behavioral, and from the court system. So basically we assess the needs of the child and the family and refer them out to different agencies. But a lot of the time, what we're experiencing is an overload of some of our agencies and some of our clients who might have been seen in October are not getting seen until, fairly recently here in January. So what exactly is out there for our clients to receive more expedited services?
So I'll take that one. I'll start. So in our agency, finding child psychiatrist is like finding unicorns sometimes, especially those ones that will come down to South Louisiana and participate. We do have child psychiatry at all of our sites. We also have clinicians that are trained and have certifications in child and adolescent services. And so we find that we get overloaded a lot with referrals from school systems. They're not quite sure what to do with that individual in the school setting, so they'll send them to our clinic. They're not really appropriate sometimes for care, but I feel like where we could come together, and I'd like to be able to talk with you afterwards, is that we'd like to do some education and training with the counselors in the school setting so that we could get on the same page and be standardized about what things actually constitute a referral and then what resources are available. And so I think that's the first point of conversation that we need to have, and it's a big one. We talk about that all the time in our clinic setting with our managers and our counselors, but being able to have that conversation, and then also to be able to do more individual sessions with those children and adolescents that come into us, but also doing more group things, because it's easier, I find, with adolescents to be able to speak to one another and to hear what's going on with them, and they'll share more. So I think that that's an important part of it as well.
So a question for everyone, we could go left to right. How do we break this trend? Do we aim, in the media, do we aim our message at the ones that are using, or the parents who are seeing it happen?
I think both.
Yes.
Okay.
Karen?
I think both, prevention, but also how you access treatment. So those who are using know that there is a way out, and how to obtain that treatment. See?
Well, again, one of the issues from the state's perspective, too, and it gets back again to funding, I guess one of the purposes why apart from that, is the fact that it's underrepresented, and the reality is when it comes to budgeting and funding for the state government in terms of what this percentage it represents, it's somewhat underrepresented, either because of the stigma, the fact that they don't have the advocacy on the state level advocating for the funding that's needed, and that's important. And the unfortunate reality is like most things, when it comes to funding, the squeaky wheel kind of gets the grease, and we need more squeaky wheels out there in regard to behavioral services to ensure that we can get additional funding, and I think that's critical.
I think when we talk about social media, we talked about the negative parts of social media, but I certainly think that we could utilize social media. And the first thing you do is to get to the children as you go to where they are, and they're on social media. So if you want to do a social media campaign, you go to them on their level, and you address it on the sites that they're on, the social media sites, and you make that stigma go away to them. So you go to where their sites. You go to Instagram, you go to Snapchat, and you do a great social media campaign about mental health and behavioral issues, and removing that stigma. When it comes to the adults, again, most of us are not on those apps or those websites, so you do a different type of social media campaign, a lot like this, whether it be on television or whether it be through your newspapers or something else. But social media can be utilized to get the message out about resources and how it's a conversation that we need to continue to have.
Yeah, I think we all need to YouTube shows like this and put it out there. But when Dr. Tedesco came on a couple of years ago and told about the 53 overdoses, this community was in shock. Mm-hmm. No one knew that. So transparency, too, and that shock value, no one thought 53 people would die in Terrebonne Parish, but they did, and you brought it to light.
I want to correct, I made a misstatement a minute ago when I said the number of homicides. It was 11, not 21.
Yeah, 11 homicides and 53 overdoses, right?
Right.
Yeah.
But last year was 37
Yeah, it came down, right.
The other thing I think that if the media has any, for people to understand that both mental health problems and substance abuse is a disease, and it is treatable. It may not be curable, but it's treatable, and the symptoms can be managed if we get cooperation with those that are suffering from.
Okay. Lauren?
Yeah, what I've been kind of reflecting on is this, both access to services and prevention work is so important. Once families are getting connected to these services, it's so important for our systems to talk to each other. We need everyone collaborating and working together, because many times children and families are in need of multiple different types of services. They don't just need treatment, they also need financial assistance, they also need workforce development services, and it's so important for these agencies to have those relationships already in place to support families simultaneously.
Right. Lisa, I'm going to kick it back to you for some final thoughts, I'm sure.
Sure. So if we could bring up what the graphics on strategies, I just want to reiterate a few points that we've talked about today. The most important things that you can do to advocate for individuals with behavioral health is, number one, ask. It's just that simple. Ask them what they need, what they want. I think we've had a good conversation here today about things that are working really well, and then things that we need to improve upon. The second thing is don't judge. You haven't walked a mile in their shoes, so don't judge. You don't know what's going on in their life at that point in time. The third thing is educate yourself and your family about the invisible illnesses. Behavioral health is not always visible. You know, addiction sometimes is, but not always. And so, you know, we need to break down the stigmas and the stereotypes. And the fourth thing is to be a good friend, even if it's hard. We all know that individuals that are suffering from behavioral health issues might be a little difficult to deal with sometimes if they're going through manic crisis and things like that. But it's to be that friend. And once again, ask what you can do to help. Be patient, be kind. And then the last thing is to, you know, get in touch maybe with a behavioral health clinic or with a home or a treatment facility and ask them what you can do to help volunteer. Maybe if it's even just bringing some, you know, journals and some books and things like that, it'll make a huge difference. I think about the holidays and things like that. If they're in institutions, a lot of times family can't get to them, they won't be a part of it. So anything that you can do to help kind of, you know, bond that over would be helpful, and it, you know, kindness can help create change. And so I do want to take a minute to thank all of our panelists here today. They've done an amazing job fielding the questions and sharing information. Can we give them a round of applause, please? I also want to thank Mental Health Association of America. Laura Lanier and her staff are here for helping co-sponsor us. Can we give them a round of applause? And as always, we want to thank HTV, Martin Foltz and his staff. They've done a phenomenal job helping us get set up for this event. Can we give them a round of applause as well? And Jason, if we can look at that last graphic, some of you are probably going, I think that they all have puzzle pieces on their lapels. And you're right. We've talked about all the different types of services and resources that we have in the community. And the theme for our agency this year is about the puzzle piece. And I just want to share what's on the screen with you right now. You are a part of a puzzle in someone's life. You may never know where you fit, but someone's life may never be complete without you in it. So all of you all will be leaving here with the puzzle piece just to remind you that you are important, that you are a resource in the community, and that you, even though you may not know it, can make a huge impact on someone else's life. So thank you all for being here, and thank you once again to our co-sponsors. Martin, is there anything that you want to add?
I just wanted to remind State Representative Zarang that they put a lot of pressure on you to go to Baton Rouge and bring back a lot of money. So, hey, good luck with that.
We're working on it. We're working on it.
Wait, hold on one second.
In May, there is a legislative day where many of the agencies get together. Mental Health Association will be part of that charge, so we'll be in touch. And if y'all have anything you want to add, please see us. Thank you.
Thank you.
And as always, we'll just add that we can put our graphic up about all our clinic sites. So if there are issues, individuals have questions in the community, you can contact one of our clinics. There's also our call line, that 800 number, 877-500-9997. So, you know, get in touch with us, and we'll see what we can do to help you. And we can also link you up with some of these panelists and see what they can do for you as well if we need them.
You know, the next one we do like this should be in a civic center.
Okay.
We shouldn't just have 100 people.
Okay.
We should have a whole community
All right.
to combat that. So
we're ready.
we're going to work on that.
Thank
All right.
you. Thank you very much.